Hi everyone, welcome to today's session. So, a bit of a delay, a 10-minute delay. Apologies for that. I was just getting my technical part of things. Today's session, a very important session, I would say, on a topic that is extremely important for every gynecologist. It is a very important problem, even more so in India, given the reasons why that problem occurs is much more prevalent in India than in any other countries. Um, the topic for today, as you must have read on my screen, is going to be post-menopausal bleeding. So I'll be talking about what are the types, what are the reasons of postmenopausal bleeding. Apart from that, along with it, I'm also going to be talking about how do we manage them. It starts from diagnosis as well as the treatment part of it. So before I begin, could you just all let me know if my voice is proper? Gaurav, could you just tell me if my voice is not cracking?
Yes, sir. Proper. Yes, sir.
It's proper, right?
Yes, sir.
Okay, thank you. So, what is postmenopausal bleeding? The first question that everyone should have, what is postmenopausal bleeding? And the basic question is going to be answered by the definition of menopause. So, when I talk of menopause, I define menopause as, or I rather, the world defines menopause as the period of that life that begins 1 year after a female has had no complete menses for the entire duration of year. So basically, the period that begins once a female has not had menses for the last 1 year, and that should not be because of pregnancy. So 1 year without menses. The simplest definition. And postmenopausal bleeding is basically when you have had this 1 year already. When you have had this 1 year already, but now after that 1 year of no menses, you have started having bleeding. So bleeding after 1 year of no menses. ठीक है. Very simple definition, no rocket science in it. Now, what are the causes? And why did I say that it is one of the more common incidents or one of the more common complaints in India? First of all, where does this fall under? This falls under AUB, that is abnormal uterine bleeding, though not completely, because postmenopausal bleeding is not only and only because of uterus, which is why I often refrain from using the term abnormal uterine bleeding as an equivalent to postmenopausal bleeding, because abnormal uterine bleeding has everything that concerns your uterus. It can be adenomyosis, it can be your leiomyoma, endometrial polyp, or it can be even a malignancy like endometrial malignancy, some coagulopathy, but everything is only and only restricted to your uterus. It does not even include your cervical cancer, which is why AUB is not equivalent to postmenopausal bleeding. Postmenopausal bleeding can be one of the types of abnormal uterine bleeding, but not in entirety. क्यों? So अभी ये बात याद रखनी है. We have to remember one thing, that whenever a female is experiencing postmenopausal bleeding, that bleeding can be from any point, right from her vulva that lies completely outside, which includes your labia majora and minora, से लेके पूरे uterine fundus तक, anything that comes in between can be the cause of that postmenopausal bleeding. So what are the leading reasons why this happens? This is my uterus and this is my vagina. So talking about the uterus first, the causes of bleeding in the uterus are going to be, सबसे पहले तो आता है मेरा यूट्रस के ऊपर का important differential diagnosis, that is endometrial hyperplasia. So basically, the endometrium is proliferating. I shall be talking a lot more about endometrial hyperplasia today. I'm going to be describing it in complete detail. But before that, I'm just enlisting out all the causes. So endometrial hyperplasia. What we can also have is Imagine this is your normal endometrium, which usually is very thin after your menopause. How thin? It can be as thin as 0.5 to 1 millimeter ideally. So endometrial hyperplasia हो गया जहां पे there was a thickening layer, thick हुआ था यहाँ पे. So this can be one of the causes. The other one can be something like a polyp. So endometrial polyp. You would ask me, why not a fibroid? The reason is that post-menopausally, all the hormones in your body, all the female hormones, that is your estrogen and progesterone, are down to the least amount that they have ever been. Now your fibroid is, as we have discussed in one of my previous lectures 2 weeks ago, that your fibroid has several estrogen and progesterone receptors, and they are sensitive to it. So once your body is devoid of all these hormones, all both these hormones, then your fibroid is not going to progress, and often your fibroid is going to regress, which is why fibroid is a very, very, very unlikely cause of bleeding per vaginum after your menopause. But endometrial polyp, definitely. क्यों आना चाहिए polyp? If a fibroid is not happening, why is a polyp occurring, or why is endometrial hyperplasia occurring? I'm going to be discussing both of it when I talk on the topic of endometrial hyperplasia today. Apart from that, you can have, you see, this is an irregular surface. Endometrial carcinoma. एंडोमेट्रियल सीए हो सकता है. So these are the uterine causes of bleeding. Cervix में you can have either a cervical polyp, very likely, very commonly seen, or you can also have cervical cancer, cervical CA. You come further below, come to this region, you have your vagina and you have your vulva over here. You have atrophic vulvovaginitis. Now, this is a term that a lot of you all might be new to. I'll be explaining it in detail today as well. So these are your all the local regional causes, all your very important causes of post-menopausal bleeding. कुछ systemic cause भी हो सकता है definitely. If a female is consuming hormone replacement therapy which contains estrogen and progesterone, when you are giving artificially बाहर से exogenous estrogen and progesterone, you are artificially making the endometrium proliferate again. After menopause, this shouldn't have happened, but you're making it happen again. Why are you doing it? You're not doing it for the uterus. You're doing it because the female had other symptoms like vasomotor symptoms. The female probably had osteoporosis. The patient had psychiatric symptoms. So basically, the patient had other systemic effects. To nullify that, you needed to give her estrogen and progesterone again. Estrogen you should have been giving her, but if you just give her estrogen, all the symptoms would be resolved. But just excessive estrogen can lead to endometrial cancer, endometrial proliferation, which is why you also have to augment it with progesterone. So postmenopausally, estrogen is the important hormone, not progesterone, but you have to give it. क्यों देना पड़ रहा है? क्योंकि you have a uterus in situ which can have endometrial hyperplasia and endometrial cancer because of excessive estrogen or unopposed estrogen, which is why we always give E plus P in a female who has a uterus intact. सो हार्मोन रिप्लेसमेंट थेरेपी जब दोगे तब भी ये जाके हो सकता है. सो दिस गिव्स अस all the causes. So seven leading causes of your endometrial cancer, your leading causes, which is the one that occurs the most or most number of times. Now, if you're going to read in Nowak and Berek and Nowak, which is a book of gynecology, which I definitely recommend everyone to read, which is one of the best books that I would say for gynecology, it says that in the chapter of postmenopausal bleeding, they give one prevalence that is quite not the same prevalence that they have given, or rather the incident of each of this is not the same as it is given in the chapter of endometrial cancer or uterine carcinoma. So I'm going to be giving you the incidences as they have mentioned in the chapter of postmenopausal bleeding.